Hello everyone, I am Dr. Trupti Mehta, Senior IVF Consultant at Sir H.N. Reliance Foundation Hospital. I am here to talk about egg freezing. Today women are at the forefront in so many fields, right from being a CEO who runs a Fortune 500 company to heading and managing households. But the one thing which is common and equally important in the life of every woman is the ability to reproduce. In simple terms, to bear a child. This ability is at its peak during the age of 24 to 34 years, but unfortunately starts to decline with growing age. There are bound to be situations when a woman needs to delay or cannot fulfill her wish of conception at the right age due to various reasons like uncertainty due to career choices, financial instability, inability to find or be sure of the right partner, certain gynecological or ovarian disorders or surgeries which risk damage to the ovaries, chromosomal abnormalities like Turner syndrome, Fragile X syndrome, a family history of early menopause, genetic mutations like BRCA1 which sometimes require removal of the ovaries, or of course, last but not the least, when women are diagnosed with cancer and require chemotherapy with or without radiotherapy, which is known to seriously affect fertility. It is in such scenarios that we earnestly recommend the option of egg freezing, which is safe and effective. The very first step in this process is to understand the reproductive potential. This can be evaluated by two tests. One is a blood level of AMH, that is anti-Mullerian hormone, and second is a USG to check for ovarian size and the antral follicle count, which means the number of follicles seen in the ovaries within the first 3 days of menses. While egg freezing is a multi-step process, it's a lot more straightforward than people may think. It's exactly the same process as IVF or ICSI. The only difference being that after egg retrieval, the eggs are frozen rather than fertilizing them with the sperm. The process involves hormonal injections to be taken for stimulation of the ovaries for about 8 to 12 days, followed by transvaginal retrieval under anesthesia, selecting those eggs which are mature and then freezing and storing the same. Although egg freezing is possible by either slow freezing or vitrification, we at the Well Women Center use vitrification, which has a much higher rate of survival of the eggs after thawing and increased chances of pregnancy. Even today, for egg freezing, most infertility clinics face a technical challenge in their laboratory. However, here at the Well Women Center, we have meticulously planned an easy to use yet efficient laboratory protocol to ensure good results. Thus, whenever women wish to use their frozen eggs, our embryology team will thaw them by placing in a warming solution, followed by their detailed assessment. The eggs which survive the thawing process will be fertilized with sperm from the partner or a donor by the process of ICSI or IVF. You all will be glad to know that till date, approximately 5,000 babies have been born worldwide by using frozen eggs. Although egg freezing does not guarantee a successful pregnancy or live birth, the chances of success are mainly determined by two factors. One is the age at which it is done. Women who freeze their eggs when they are under the age of 38 are more likely to have a baby. Apart from the age, the other parameter central to predicting the success rate of the procedure is the number of eggs. Studies have proven that the more the number of eggs for freezing, the higher the birth rate. Hence, I would like to sincerely request all women to please be aware of your health and fertility parameters so that if you wish to opt for egg freezing and happen to be the right candidate for it, we can guide you through this amazing process. Thank you.